Welcome to the Medical Ancillary Sales Podcast, your number one source for making money in the medical ancillary sector. Mike and Viv bring you the latest information from lab services, pharmacy, diagnostic testing, and so much more. The latest in ancillary services will be right around the corner. Welcoming the hosts of the Medical Ancillary Sales Podcast, here's Mike and Viv.
Hello and welcome to the Medical Ancillary Sales Podcast. I'm your host, Michael Berg, and joined as always by Viv Hudson. Hi, Viv. How are you?
I'm great, thanks, Mike. And I'm pretty excited because you're my special guest today, or I should say our special guest, but welcome to the show, Mike.
Well, thank you. It's a pleasure to be here, as always.
So today we thought that we'd do something a little bit on the sales line again. So we like to mix it up by giving you information on different solutions, but also with giving you various sales tips that help you out in the field. So today, I know Mike is a pretty avid reader as far as self-development in the field of any way that he can make his business better or bigger. He's reading it. So I know one of his favorite books is Spin Selling, and Spin Selling has been around for a while, and it really looks at addressing a need for whoever the purchaser is. So, Mike, tell me a little bit about spin selling, from your perspective.
Thank you, Viv. Yeah, so I've read a bunch of these books. I had a whole bookshelf before. I went through a move recently, and I realized I got a bunch of books that I never read anymore. And I basically got rid of a bunch of them, but there was a couple that I held on to. And spin selling has been something that I've used in my career since I think I read it back when I was an undergrad. I was selling something, and I don't even remember what I was selling, but somehow I think it was a professor turned me onto the book, and I found it useful because it's a very practical book. It's a one-day read sort of book, and so with all these different types of self-help or different sales tactic books. Some of them are great, but I don't really retain the information. But what I really liked about this book is that here it is, probably 18, 20 years ago that I read that book for the first time. And I still use the tools and tricks. I mean, it's something that I've carried with me through my sales career. And it's very practical information that will definitely make you money.
Excellent. So today, we thought it would be a good idea if we could use spin selling, but actually apply it to one of the solutions. So it would give people a practical example of how we would use that. So are you ready, Mike? So let me give a little background though first, Viv, and then we can jump into it. So so everybody knows, because I know not everyone's going to go out and read the book. And honestly, it's not a book that you have to go out and purchase, because you're going to get the gist of it right here of what it entails. But SPIN is an acronym for, it's S-P-I-N. S is for situation, P, problem, I, implication, N, need, payoff. So what you're doing, someone told me early on in my sales career, I remember I had a sales manager, and you've heard me say this many times, Viv, and I've probably said it on the podcast, that telling ain't selling. If you're just regurgitating information at anyone you're selling to, especially physicians who are trained buyers, they have people selling to them constantly. So they are well-versed in dealing with salespeople. And if you're just going in there with the purpose of, I have all this information, I want to regurgitate it on the doctor and show him how much information I know, you're not going to get anywhere. And I see a lot of salespeople that fall into that trap. And so what spin selling allows you to do is it almost allows you to make kind of a judo move on the doctor and let them sell themselves. So, if you use those, that combination, that formula for how you structure your questions, you'll be surprised how the results that you get from it. So one of the popular tests that we have right now that obviously we've talked a lot about is the PCR test, the respiratory and GI pathogen test.
right now it's a hot test because all the testing is done basically October to March. We're really at the very beginning stages of this. So I thought this would be fun to do a little role play and show you how spin selling would actually work in a sales situation. So you could put this into use today, the day you're listening to this, and have some orders in tomorrow. This is not something that takes 6 months to get paid on either. You get paid next month on this if you get something in today.
Sounds good. Sounds good. So to get started, we're going to look at the PCR. So the question would be, is that what you want me to do, is address a question to you?
Well, here's the situation. I'm the sales rep. I'm going to be coming in. Viv, you are the doctor, because let's face it, you're the closest to a doctor that we have. You can play that part better than I can. So I'm walking in I got my brochures in hand. I got my physician sign up in hand. I'm ready to get you going on the PCR test. But the last thing that I should be doing is pulling that flyer out and handing it to the doctor first. I haven't even addressed the need yet. So I'm just going to call you Dr. Viv. Dr. Viv, how are you today?
I'm great, thanks. How are you going there, Mike?
I'm doing great. I know you're short on time. And Dr. Viv, I should say, the reason I wanted to talk to you today, I know we're hitting the beginning of cold and flu season. I'm sure you're getting a lot of acute patients that are coming in exhibiting cold symptoms and flu-like symptoms. So my question for you, I'm curious, how do you diagnose and treat those patients who exhibit GI disorders or upper respiratory illness?
So typically what I do is look at the symptoms. Has the patient got a sore throat, runny nose? Is there any coloured mucus? And essentially what we're doing is making an educated guess to decide whether we need to prescribe something for the patient or not. And when we do prescribe, it is a bit of an educated guess as to what that is going to be, because sometimes we don't always know if we're treating a bacteria or a virus.
So I know that oftentimes patients can exhibit similar symptoms, but for widely different illnesses that also have widely different treatments. So what are the problems that can arise from that?
Well, sometimes we might prescribe an antibiotic and it ends up being a viral infection. So that doesn't benefit the patient because it hasn't actually helped them. Sometimes we think it's a virus and it ends up being a bacteria, and that results in either treatment being delayed or antibiotics being unnecessarily prescribed.
Okay, so if you're delaying treatment to the patient, what are the possible risks?
Well, first of all, they could actually spread the disease to more people because they're not being treated appropriately. And in certain populations, particularly if that person is a healthcare worker or works in a school or whatever, they could be spreading those infections to people that put them at risk. And sometimes those people are then going home to families with people who are unwell or perhaps having cancer treatment or whatever.
And what about the use of overprescription of antibiotics? I know we hear a lot about that, but what is the risk of prescribing unnecessary antibiotics?
Well, it's a massive problem, and it's not just in the United States. It's actually a global problem because there's been a lot of pressure. I mean, when patients are sick and they go to the doctor, they kind of expect to get antibiotics, and antibiotics are not always going to be effective. So if we have a virus, there's no antibiotic out there that will kill a virus. So antibiotics have been prescribed in overuse, which has resulted in many resistant strains becoming present in the population, which then makes it more and more difficult to treat those same infections because those antibiotics are no longer effective. So it becomes a public health issue.
So, Dr. Viv, if I'm reading you right, if you were given a more objective tool to be able to quickly identify the specific pathogen that your patient is afflicted with, how would that change the way you treat your patients?
Well, obviously, you'd be able to give a lot more targeted treatment right off the bat. It's going to give the patient comfort that they are getting a treatment option that is going to work for them. Because sometimes an antibiotic might be prescribed, and we'll say to the patient, look, if you're not getting better within a couple of days, then start taking the antibiotics. But if it's a virus, there's no need for that to occur. So it's definitely going to help patients get the right treatments straight up a lot quicker. And particularly when we're talking about flu viruses, if we get the diagnosis very quickly, then there are antivirals that can be prescribed. And once it goes beyond a certain time frame, the antivirals are no longer effective. So in the traditional sense, if we were sending off the cultures for the pathogens to be cultured, it can be 3 or 4 days before we get the results, whereas obviously having something back quicker enables us to be able to use those antivirals that would be superfluous in a different situation.
Plus a lot of false positives with cultures, let's face it. And Doctor, how familiar are you with PCR molecular technology?
So PCR molecular technology, I don't really know much about it. Would you be able to tell me some more about it?
All right. I'm going to end it right there, Viv, because we're running out of time. At this point, as a sales rep, this is when you're pulling out your flyer. You notice, we had a 5-minute conversation before I even mentioned PCR, before I even pulled that flyer out of my bag. Why? Because I'm listening to the doctor. So just to kind of do a quick recap on this. So it spins. Situation first. You're setting them up. What is this situation? How do you diagnose and treat your patients who have symptoms of upper respiratory or GI? What is the problem with the different types of delayed treatment? What is the implication of that? So we had, and Dr. Viv answered, well, if we, for the problem, oftentimes patients exhibit similar symptoms for different disease states, and that will delay treatment, and that could lead to overprescription of antibiotics. Then we go into the implication. What's the implication of that problem? If you delay treatment to a patient, well, you could spread it to other people. The pathogens will spread within your own body. It could develop into a more serious health risk. You could spread to other people, etc. Plus, we talked about the unnecessary use of antibiotics and how we have those antibiotic-resistant strains going around. So we already went through, we did the situation. Now we set up the problem. What's the implication of that problem? And then we get to the end, the need payoff. So doctor, if you had a more objective tool to be able to diagnose and specifically identify which pathogens are afflicting that patient, how would that change the way you treat your patients? Now at that point, they've already sold themselves. I'm telling you, they already sold themselves at that point. Now you start talking about the PCR test and you can pull your flyer. Are you familiar with this technology? And Dr. Viv already mentioned it, that you mentioned cultures. I have talked to a couple sales reps already who said, well, they ran into a brick wall there because they said they don't do that or they get false positives. Well, yeah, with cultures you do, but this is actually a molecular test. This looks at DNA that's left behind from bacteria or viruses. That's actually what's going on. So most doctors are not really familiar with this technology as of now. So that's why we've done a good job at setting them up. They've already basically sold themselves. So what you're telling me, doctor, is that you're looking for more objective tools. Okay, great. Have you heard about PCR technology? No, I haven't. Okay, let me tell you about it. And that's when you pull the flyer out. I could go on and on, Viv, but we're at 13 minutes. I'm not perfect at this, guys. I'm just telling you, this is a formula that works, and it's not just in medicine. I've used it. I sold in the dental world. I sold pharmaceuticals. Not just these labs tests, and this has worked for me consistently. So.
Okay, well, it takes just a little bit of time to think about that for each solution, but you can certainly, as you say, transpose that to whatever you sell. So it's just adapting that formula. Thanks, Mike. That was great information, and I'm sure that everybody will take something home from that to be able to be more successful in sales.
Absolutely, and you guys don't have to rush out and buy the book. Just Google spin selling. And you can find enough information online, and then just think about those 4 types of questions and anything that you are trying to position with the doctor. Think about doing it in that formula, and you'll be surprised at the results you get. All right. Thank you, Dr. Viv.
Thank you. And I like being a doctor.
All All right. Thanks, everyone.